So now the importance of immunization. What are the benefits? What are the importance? What are the advantages of immunization? Number one is it saves lives. Like I said, it has saved millions of lives, and it is saving lives every year. So immunization is very good because it saves life. It protects your children from all these serious diseases, from all these tuberculosis, measles, all these diseases that are flying, that are rampant in our environment. So immunization protects your child from all of these diseases. Then it saves time and money. It saves time and money. It will save your time, it will save your money, compared to if if your child is diagnosed with this serious illness that you have to take him to hospital. You have to spend a lot on her. Then another thing is it reduces the rate of mortality and morbidity of under 5 children. This means that it will prevent your child from dying untimely. So it has reduced the rate of mortality and morbidity of under 5 children. So the disadvantages of immunization is that all these diseases that I've been talking about, if your child is not vaccinated against all of these diseases, your child is at risk of contacting all of these diseases, is at high risk of contacting all of these diseases, tuberculosis, measles, hepatitis. Your child is at high risk of contacting it. So why not prevent your child from all of these diseases? Like I said earlier, that you should imagine a child, a 6-month-old baby diagnosed with hepatitis. Imagine a 6 weeks baby diagnosed with tuberculosis. Is a very, very terrible experience that we have to protect our children from. So now let's move to the immunization schedule in Nigeria, the latest one. This is the latest immunization schedule in Nigeria. So the first one is your child is taking immunization, is taking vaccine at birth, and the birth is taking like 3 vaccines at birth. Is taking OPV 0, is taking HBV 0 and BCG. So your child is taking these 3 vaccines at birth. BCG is Bacillus clamates glurine at birth, is to prevent tuberculosis. Icoife is to prevent tuberculosis at birth, and is given given at the left upper arm, 0.05 at the left upper arm, intradermal at the left upper arm. Then we have OPV 0. OPV 0 is means at birth. So OPV is oral polio vaccine. So your child is to prevent poliomyelitis, àrùn rọmọlápá rọmọlẹ́sẹ̀. This is if a child did not take it, that's when you will see some child that is having deformity of the hand, of the legs. So this polio vaccine prevents that. So it's oral and it's 2 drops. They will give your child 2 drops of OPV at birth. Then the last one is hepatitis B. So HBV 0 means at birth. So hepatitis B is given at birth. So that one is 0.5 ml IM intramuscular at the right thigh. So then you are coming again at 6 weeks for another vaccine. So this time around your child is taking 5 different vaccines. So now the first one is OPV 1. You know, he or she took OPV 0 at birth. So now the child is taking OPV 1. This is the second dose, but it will be 1 because it's 1 month plus. So OPV 1 oral polio vaccine is to prevent polio, and is dropped 2 drops of OPV. Then your child is taking rotavirus. Rotavirus 2 is oral. Is to prevent diarrhea in children. That is igbegburu. Is to prevent that in children, and you can have like 2 to 5 drops of that, of rotavirus. Then after that your child is taking PCV1. PCV is pneumococcal conjugated vaccine. Is any diseases that can cause pneumococcal infection. That is all these pneumococcal disease like the lungs, the disease of the lungs. So this one prevents that. This is PCV1. Is 0.5 ml and is IM at the right thigh. The fourth one is IPV1. IPV is inactivated polio vaccine. This is for polio again. We have 2 vaccines for polio. We have oral OPV. We have IPV, which is inactivated polio vaccine. This is injectable. You have to inject. So it's 0.5 ml at the right thigh. So now your child is taking PCV and IPV at the right thigh, but the nurse will give it at the space of 2.5 centimeters. So it won't be at the same spot. So then the last one is pentavalent. This is 5-in-1 vaccine. It contains is preventing your child from 5 different diseases. Let me mention the name of the disease: diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenza type B disease. So it's all of these diseases is pentavalent vaccine. So it's preventing your child from these 5 different diseases. So it's given at the left thigh, 0.5 mils IM at the left. That's why that left thigh, that one is the, it's contains 5 different types of vaccines. So it's preventing your child from 5 different type of diseases. So now that is that at 6 weeks. Then you are coming again at 10 weeks. Your child is now taking 4 vaccines. This is OPV2 at 2 months plus, OPV2, rotavirus 2, PCV2, which is 0.5 mils, and pentavalent 0.5 mils. So now it's just IPV that your child is not taking at 10 weeks. So your child is taking PCV at the right thigh and pentavalent at the left thigh. Penta is always at the left, pentavalent at the left thigh. So he's taking all of this at 10 weeks. Then at 14 weeks, your child is coming again for another vaccine. This time around, she's taking just exactly the same vaccine she took at 6 weeks. So she's taking 5 different type of vaccine at 14 weeks. That's OPV3, rotavirus 3, PCV3, IPV2. IPV is not taken at 10 weeks. So this one is IPV2 and pentavalent at 5. This is at 14 weeks. So pentavalent. So all of this, PCV and IPV will be at the right thigh. So she's taking two vaccine at the right thigh, which is 2 centimeters far away from each other, and penta will be at the left thigh. Then rota and OPV, they are orals. So they are drops. So they will give them by mouth. Then at 6 months, the child is coming again for vitamin A. Vitamin A is good is good for good eyesight. It's very good for good eyesight. So vitamin A that's the first dose. Your child is taking vitamin A every 6 months. So it's coming again at 1 year. It's coming again at 1 year, 6 months, 2 years, like that till 5 years. So your child is taking vitamin A up to every 6 months till 5 years. So it's to help for good eyesight, and it is 100,000 international units. That's the dosage. It's oral too. So vitamin A, it has blue capsule. So you'll be giving that vitamin A as the mother. You use your teeth to cut it and you press it on the mouth of the baby. So that's vitamin A. So at 9 months, your child is coming for 2 vaccine. That is measles and yellow fever. Measles is given is subcutaneous and is given at the left upper arm, while yellow fever is given at the right upper arm. At the arm, to be at the right and the left. So that's measles and yellow fever. So measles is to prevent measles, yellow fever is to prevent yellow fever disease. So that's that. Then at 12 months, at 1 year, your child is coming again for meningitis vaccine. That one is IM 0.5 mils at the left thigh. He's taking that at the left thigh, and also he's taking vitamin A. I said vitamin A is every 6 months. From 6 months, so every 6 months till 5 years. So vitamin A2, that will be vitamin A2, and that one is 200,000 international units. It's oral, like I said, but this one, the color is red. The first one is blue, so this one is red capsule. You cut it and you press it on your child's mouth. So that's that. You're taking that every 6 months to 5 years. So now at 15 months, that's 1 year, 3 months, your child is coming again for second dose of measles. Measles 0.5 is subcutaneous, is at the left upper arm. We call that MCV, measles vaccine. It's taking that's the second dose of measles. Then that is that. Then now, presently now, they've introduced HBV, that's human papilloma virus. It's now given at 9 years. So now at 9 years, you have to bring your child for human papilloma virus. So that is that. Now let's go to the last one, which is the care given to children after immunization. So the care we give to our children after immunization, the first vaccine they are taking at birth is very, very safe. It doesn't cause anything, doesn't cause high temperature, it doesn't cause fever. So you don't have to give your child anything at birth. The vaccine they are taking is very, very safe. But the subsequent one, the one at 6 weeks, you have to give paracetamol. You have to give that at birth, and you have to give that at 6 weeks. Is to reduce their temperature and to relieve pain. So you have to give that after the vaccine. You can give they will tell you the brand of the paracetamol you can get at the primary health care. So you give that 2.5 mils. That will be every 6 hours. You can give for 2 days or 3 days. depends on if the temperature is still there. So you can give that every 6 hours paracetamol, and at 10 weeks to all of the other types you give paracetamol, because those ones, they are strong. Your child is taking different types of vaccine at that time, so you have to give paracetamol with that. Then the care of BCG is tuberculosis, is to prevent tuberculosis, and this tuberculosis is live weakened, live attenuated vaccine. They are living but weak. This is the type of vaccine. This is BCG. So you want to prevent the spread of, because it still contains BCG. It contains tuberculosis virus, tuberculosis microorganism that is causing tuberculosis. So you want to prevent the spread, because it's given at the left upper arm. So sometimes for some baby, you see that the place will become swelling. It will become swollen up. So you have to use the care is that you use your cotton wool to clean that site every maybe anytime your baby, after bathing your baby, you clean it. And sometimes it can be bringing out pus, so you clean it, and after cleaning it, you have to discard the cotton wool inside the WC. You have to discard it. You don't just throw it anywhere, because that thing contains live virus. So you have to discard it. That is the care. So in conclusion, immunization only hurts your child for a few seconds. So therefore, you should give your child the best protection that will protect them from all these serious diseases. So take your child for vaccination, because it protects your child from all of these diseases. Thank you so much for listening. I want you to please comment and share. Thank you so much. My name is Okiki Oluwaodeleye. I'm aka Nurse Kiki. Thank you so much for watching. God bless you.